start the recording. Thank you so much. So welcome everyone, and I hope 2022 is treating everybody well and you've all had a safe start to the year. This is our first movement call of 2022, so I want to take the opportunity on behalf of all of us at the movement to wish you a very, very warm and wonderful 2022. And thank you for joining us today. I'm Gunjan Veda. I am Senior Advisor with the Movement for Community-Led Development, and I have the honor and pleasure of hosting these COVID calls with Nellie Mecklenburg from the Institute of State Effectiveness. So we're delighted to have you here, and it's unbelievable, but it's almost close to 2 years since we started these COVID calls. So we started in the April of 2020, and here we are in the January of 2022 with the pandemic still going on, all of us still grappling with COVID and still having these COVID calls, albeit less frequently, because as I was just mentioning before we officially started the call, it's been a while since our last COVID call. But before we go any further, I do want to take this opportunity to say a big, big thank you to all of you. It's been a very difficult 2 years, I know, emotionally, mentally, physically, financially, professionally, all of us have had to deal with so much. And yet you've stayed with us. You've come to these calls, shared your time, your experiences, your creativity, you know, the ways you have been dealing with it, sharing that knowledge, that information, and that has meant so much. That just creating the space for all of us to be able to work together month after month has been amazing, and it wouldn't have happened without all of you. So thank you so much for being with us on this journey and for, you know, sharing so generously of your time and experience. Also, this has been such a fabulous year for MCLD 2021, you know, so despite all of the issues that we had to deal with and grapple with, thanks to all of you and each one of our members, it has been an amazing year for community-led development and for MCLD. We've had some of the biggest funding organizations in the world take notice and understand that they need to change the way that they do their work. We've had, you know, we found seats at the policy tables. We've seen organizations like USAID announce a very definitive shift towards more locally led development and community-led development. We've seen some of our wonderful members like Dr. Rebecca feature in a book, you know, their stories of how they do their work. We've had new national chapters come up in Nigeria, in Liberia. We have new chapters coming up in Sierra Leone, in Pakistan, and in other countries, you know. We won the USAID Collaborative Research Award. The tools that we co-created are being used extensively all over the world, so much so that we are struggling with the demand for it. We've had governments coming in and asking about how they can, you know, be part of this movement, how they can ensure that their officers are aware of how to work with communities and can do that better. So we've signed MOUs with the government in Kenya, for instance. It's been such a phenomenal year despite all the challenges of the pandemic. And it's been possible because of every one of you. So I want to, even before we start this call on a very important topic, I wanted to take the minute to just say congratulations to all of us. And I hope 2022 takes us forward in this journey. So for those of you who are new here and who don't know the movement, John, if you can get the slide back up, please. Perfect. So for those of you who are new to the Movement for Community-Led Development was launched the same day that the Sustainable Development Goals were adopted by the UN General Assembly. So John, if you go down, the next slide, please. Sorry. So it was a group of people who came together and said, well, this is wonderful, but remember what happened with the MDGs. If you're really serious about these Sustainable Development Goals, then we have to make sure that communities are front and center in development. And so the movement was created and launched. And today we are a very vibrant group of over 1,500 local civil society organizations and 70 INGOs from all over the world. who are committed to community-led development and who work through various parts, right? So we have our national chapters, which are the heart and soul of our movement. And I see many representatives from our national chapters here today. And these are really organic groups of organizations and people who come together, who work with national governments on devolution, who've really in this past couple of years with the COVID, with the pandemic, they've been working with the national governments to make sure that communities are informed, that communities have access to the vaccine and information. They've been part of the policy formulation process. The Hunger Project serves as the global secretariat for the movement. So if we go to the previous slide, John, sorry, I'm messing up the order a little bit here. But today's call is the 15th in our Adapting CLD Programming to COVID-19 and Beyond series. And as you know, we started in, like I mentioned, in the April of 2020. And since then, we've covered a whole range of issues. So if you remember, we started out really by just trying to unpack what do we do in a world of lockdowns, in a world where there is no international travel, where movement is restricted. How do we carry on our work? Because all of us were dealing with the same set of issues. So that's where we started out, right? And then we did things like we did scenario planning workshops. We looked specifically at strategies that different organizations are, adopting to deal with the pandemic. We brought in representatives from the World Health Organization, the Africa CDC, and others to see what can we do about vaccine acceptance and accessibility. So we went through all of these issues over the course. We looked at governance, we looked at working with local governments to spread this. We looked at all kinds of issues. And then last year, we started looking at longer term responses. We started looking at, well, what have we learned with the pandemic in certain specific sectors, and what needs to be, what lessons need to be carried forward? So we looked at sectors like livelihoods, we looked at food security and nutrition, we looked at environment and climate. That was our last call, right? And there was one more issue that kept coming up that everybody wanted to talk about, and that was gender-based violence. Because the pandemic really brought the issue to the surface. It highlighted, the prevalence of gender-based violence. It put the spotlight on it, but then what happened? How did we address the rise in gender-based violence? Was there any lasting impact? Did we see any kind of change in policies and directions on it? Those are some of the issues, and what learnings do we have? All of this is what we're going to look at in today's call. So we're going to start with an introduction that I just did, and a quick way forward section where Nelly is going to take us through. Then we're going to have a couple of speakers who are really going to share with us the perspective from their own countries of what happened with gender-based violence during the pandemic and how did they respond to it, as well as a global perspective on what happened with it. Then we're going to go into our, we're going to discuss a little bit around, did we really see a change in response from different stakeholders, right? From governments, from funding agencies and others on gender-based violence with the increase that we saw during the pandemic. Then we'll do our breakout groups where each of us in our groups will look at specifically what kind of interventions were there, what can we learn, what do we carry forward. And then towards the end of the call, we're going to talk not just about our upcoming events, but we promised you a workshop on community-led monitoring and evaluation last year, and that workshop is happening next month. So we'll go over the details of that towards the end of the call. So that's our agenda for today. And with that, I will hand it over to Nelly.
Thank you, Gunjan. And yeah, just again, thank you all for joining us in this third year of COVID. And one of the things that has been with us throughout that whole time are these calls. But as Gunjan said, they have evolved since we started in April 2020. Both the topics and also the pace of the calls themselves has adjusted as the needs and the issues of the pandemic have changed. We don't hold the calls monthly anymore, but the pandemic is still happening and it's still changing. So, and we've been committed throughout the pandemic to continuing to hold this space for all of us, so long as it is useful and relevant for us. So we wanted to just do a quick check-in in January and see what you all think about these calls. Are they still relevant? Are they still useful? If so, how should we adapt them to make them fit where we all are in the pandemic? So we wanted to just do a quick poll. John, if you're able to post that. There you go. So it asks, should the COVID call series continue? And you can say, no, the calls have run their course. It's okay. You can say yes, but not so regularly. For example, we could do it when there's just a specific topic that's relevant, or we could do them, once a quarter, every 2 or 3 months. Or yes, please do them monthly. Again, we haven't been doing them monthly, but if that's what the community, what this group wants, we can try to revisit how to do that. So if everyone can just take a moment and submit a response to the poll, then once, John, you have a quorum, a good enough number, please feel free to share. Sorry?
It's Sarah who's running the poll.
Oh, Sarah, sorry. Thank you. Sarah, once there's a majority of folks, and if you can't, if you want to add any notes into the chat box instead of in the poll or in addition to the poll, please feel free to do that as well. And yes, in the meantime, if you just want to introduce yourself in the chat box also, that's helpful for everyone else. How's it coming, Sarah?
We're waiting on 11 more answers, but we have about 60%. So I can end it now if everyone who's been able to answer has done so.
Yeah, why don't you go ahead and do that, and then anybody who hasn't had a chance can do it in the chat. And are you able to share the results? There we go. Okay, so that looks like a very clear answer from the group. So nobody says the calls should stop. 17% says, yes, let's have them monthly. And the vast majority, 83% of you said yes, but not so regularly. So continuing to have them either based on a topic or just every few months to check in. So with that in mind, we'd now like to hear from you on what are some of those topics that you would like us to cover in future calls? And is there anything that we should change? So currently, sometimes we use this space to hear from members of the movement and members of the call to share what they've been doing. Sometimes it's a space where we invite people to very formally present on their work. Sometimes we use it to have just brainstorming as a group, or just a space to take a beat and breathe and appreciate everything that we've all been dealing with. So if any of those formats work better for you, we want to hear that. We want to know what works and what you're looking for. So please put some responses in the chat box or speak up on what you would like.
I'll say something. Definitely, I love the themes, but I think within the themes, it would be good to have the space to bring up what is or is not going on in the places where we serve or the places where we are. For example, now people in the communities that I'm serving are kind of tired of COVID. It's not there. It's never been there. Maybe it was a myth after all. And not wearing masks, no more distancing. They've become very lax. So if we could have the space sometime in this forum or whatever for things like that, it would be good.
Yeah, great. I hear two things in that. One being just checking in on where we all are in the pandemic, how it looks in different countries, but also having, which we've done before, making the space to hear directly from communities as much as possible, just to give them a platform to share what they're experiencing and what their priorities are. Anyone else? Are there any topics that you think you haven't, or questions that you have that haven't been addressed by other groups or forums? Call organizers can also speak up. John.
Hi, Nellie. It's, yeah, I know that in the countries where there's now starting to be a decent supply of vaccines, they're running into vaccine hesitancy. And there's probably people are coming up with some very creative ways to address that, that we should hear about and share.
Yeah, revisiting that theme. We had discussions on it, but it was before the vaccines were available. So a lot has changed now that we know more.
Yeah.
Anyone else? Well, as Gunjan mentioned, we know that our next call will be focused on community-led monitoring and evaluation. Annette points out that in DRC, there's always been vaccine hesitancy. Yep. And I think it is in some of the places where I work, it's growing. So that will be our call next month, and then we'll continue to touch base with all of you on what to shape our call afterwards on, and also when would make the most sense to have those. But feel free to share any thoughts with us independently outside of the call, or if you have a thought that comes to you anytime in the next 70 minutes, put it in the chat. But with that, I'm going to move to the topic that you all had identified back in, I think in the fall of 2021, as Gunjan said, we had highlighted this group had identified a few different themes that the pandemic really put a spotlight on. They've always been there, and they've always affected us and our communities and our colleagues, but the pandemic really made it clear that we can't sort of think of these as being the work of other organizations. They affect us personally, again, our organizations and how we run, and what the communities that we're working with care about. And so those were livelihoods and food security, which we had a call on a few months back, climate change and how it interacts with pandemics and how it affects communities, which we spoke about in September, and mental health, which has been a huge and ever-growing impact of the pandemic, and gender-based violence. So today we are dedicating the call to that topic. And as Gunjan mentioned, we're going to start our discussion by hearing from 3 speakers. We have a video from a colleague from the Hunger Project in Bangladesh, a colleague from the Kenya team of Global Communities, and also a colleague from Care International. So I'm going to just check in. Gunjan, are we sticking with hearing the video first?
Yep.
Okay.
Sarah's all set to show the video.
So just before we launch this video, I just wanted to introduce the speaker who is doing it over video so that we could have subtitles and simultaneous translation into English. But Nasima Akhtarjali is the director of programs from the Hunger Project Bangladesh, as mentioned, and she's going to be speaking about what happened with GBV, with gender-based violence in Bangladesh during the pandemic, and some of the measures that they have been taking to address it.
Hello everyone, greetings from Bangladesh. This is Nasima Akhtar Jolly, Director Program, the Hunger Project Bangladesh. It is well known that women in general are oppressed, subjugated and deprived all over the world. In Bangladesh, violence against women and girls, children and their sexual harassment are serious problems. These problems have become worse during the pandemic situations. The Hunger Project Bangladesh and National Girl Child Advocacy Forum had conducted a survey on 35 working women to get a real picture of workplace harassment and violence against women during the pandemic period. The findings shows that 100% of them have been victims of sexual harassment, one way or another. During the pandemic, some of them have been harassed 5 to 10 times. From 1st January to 31st December 2021, 1,276 girl children were raped, as per the information collected from 24 national and local newspapers by the Hunger Project. As the rate of sexual and gender-based violence is increasing day by day, so is that rate of child marriage. The fear of sexual assault of the girl children create a major risk for families. Thus, they try to get the girls married at early age. The government of Bangladesh has passed many laws to address this problem. Still, the problem persists because the existed laws are not being implemented properly. A culture of injustice still exists in the country, and there is a lack of integrated initiative. However, we are working relentlessly to deal with the issue. The Hunger Project and National Girl Child Advocacy Forum have jointly created and submitted a draft law to the Women and Children Affairs Caucus of the National Parliament to stop the violence against women and children. We have also created a network called Unleashed Women Network to raise voice against gender-based violence. Nearly 10,000 women are part of this network, and its members are closely working with the Women and Children Affairs Standing Committee of different union parishad to raise awareness on this issue by organizing campaign and courtyard meeting. They have also been providing legal support when needed. Thus, we are working on tackling this problem from the grassroots to the policy level. This work must be continued even beyond the pandemic period. Awareness building of adolescents and parents on sexual and reproductive health rights is utmost important. Also, the policy advocacy must be carried on simultaneously to ensure proper implement the existing laws and to enact new laws to prevent gender-based violence. Thanks for giving the opportunity to speak.
Thank you. And Nassima was obviously not able to join the call today. And we didn't need subtitles. That was my error. But she did say that they also had trained women leaders to arrange and conduct courtyard meetings to stop GBV. Was also one of the things that she wanted to highlight. Next, I'm going to hand it over to Frederick Nyaga. Fred is the Gender Technical Specialist for the CLEAR program in global communities based in Nairobi, Kenya. The CLEAR program is the Cooperative Leadership Engagement Advocacy and Research Program, so covering all of the topics that we care about here. He's also the founding chairperson of Men Engage Kenya Network, which promotes gender equality by engaging men and boys and preventing GBV and promoting positive fatherhood. And he has over 20 years of experience on precisely this topic. So Fred, over to you.
Thank you, Nelly. I'll just be talking about what we are doing as a program and the global communities and the intervention that we have done concerning gender-based violence during the period when we have been having the pandemic. And this CLEAR program is funded by USAID, and basically aiming at broadening the use of the cooperative business model in Kenya and facilitating more supportive legislative environment and cooperative network to enhance long-term sustainability for the cooperative movement at the community level. And basically, I'll just highlight some of the programmatic interventions that we did, but before that, perhaps I need to just mention the rationale. Why did we have to have these interventions during this period? And as many of you know, there's a very strong link between gender-based violence and economic development, because normally GBV negatively impacts the community and the productivity at all levels, even in institutions. And when you look at the cooperatives, for example, in Kenya, these are used like the vessels for community development, but usually most of them have aging population, and the old people normally are very uncomfortable talking about gender and GBV, and therefore there is need to create a safe space where people can be able to talk about these things. And many times you realize that GBV has been normalized. It's not. People normally look at it as if it is normal. They don't want to talk about it. They don't even know sometimes some of the things that happen in their lives, they don't consider them to be GBV. They think it is normal. So they just keep quiet. And at the community level, GBV may not be a priority as a result. And even at the cooperative level, because basically when cooperatives come together, when communities come together to form cooperatives, they want to make money. It's for income generation. So sometimes they may not see it as a priority, and therefore it is important to start thinking of how do we contextualize or even integrate GBV activities into the normal activities of the community and the cooperatives. And during the COVID-19, when it started, for example, in Kenya, we had a total lockdown where people stopped going to the office, the public transport were crowded. People stopped going to the market, and as a result, people found themselves in unfamiliar ground environment, where, for example, men who are used to be going out to work, they found themselves locked in houses. They didn't know what to do. They had lost their jobs, and as a result, these are some of the reasons that contributed to gender-based violence. They are not a causing factor, but these are contributing factors. And also what happened during that particular time, cooperatives that we are working with reported an increase in gender-based violence cases. They didn't know what to do. The media was also highlighting these things in the newspapers, in the TV, in the radio, and there was an outcry and people needed support. So what did we do then? As a program and as an organization, we moved in to develop training sessions or modules for cooperatives, board of management, and the leaders, basically, and also developed capacity for the boards of management to help them to prevent and respond to the GBV cases, particularly focusing on what we are calling the 4 R's. The first R was to help them to recognize GBV, because sometimes people don't know that this could be GBV. They just think this is normal. So we are able to tell them the telltale signs of GBV. How can they react when it happens? When people come to them and say, oh, I was denied food, I was insulted, I was locked out of the house. Even before you report the authorities, as a cooperative, as a group at the community level, what can you do? And we also took them, build their capacity on how to report, give them information where to report, who to report to, the methodologies of doing it, and also how to refer and the resources that they can be able to use. We also compiled and disseminated a list of service provision points and we distributed to the cooperatives so that they could pass the information to the communities that if this and this happened, you can call this number, toll-free number, or you can simply be able to visit this place for emotional support, for counseling, and so on and so forth. And as we were developing we were adapting a training curriculum for our cooperatives and for the county government, we ensured that we included GBV and sexual harassment as a core session in the manual. So how do we intend to sustain this? In a nutshell, one is that the adapted training curriculum, which has 26 sessions under 6 topics, we have categorized these sessions under 3 categories: the must know, the great to know, and the nice to know. And we are saying that GBV is a must know. So if you're going to train people under GBV, there are some sessions that they must be taken through, which we found to be key. And then the other topics in the manual, include gender concept, because you cannot really understand GBV before understanding gender and the gender dynamics. And we have GBV at cooperatives, communication household level, and at the cooperative level, cooperative governance, conflict prevention and resolution among members, and family planning and parenting. Like the later one, the last one basically is like a nice to know topic, may not be a must know. We have also trained trainers from cooperatives to roll out the guide, and also trained gender champions who can be able to advocate for gender equality and to advocate for gender-free environments in cooperatives at the community level. In addition, we are continuing to develop what we call behavior change communication materials to be used at the community level so that the message can be able to support these other trainings that are taking place. And finally, we also trained the media personnel, because when the pandemic came, there was a lot of reporting, but the reporting was not balanced. Sometimes they would do a lot of blaming the victim, blaming the survivor, but we called them and told them, no. You should never, ever blame a victim. It doesn't matter what has happened. The victim is innocent. It is the perpetrator who is always wrong. So we have trained these people and we expect them to continue talking about GBV, writing about GBV, reporting responsibly about GBV. So in a nutshell, that is basically what we did. And if you want us to talk about it more, our contact is there. We have given it. You can always reach out to us. Thank you.
Thank you so much, Fred. And you answered, I saw in the chat box, people were asking about having access to these materials. So they can reach out to you directly, and maybe we can see about circulating them. And I thought that was such a rich few minutes. Talking about, how gender-based violence impacts all kinds of activities, from health to economic activity. And so the pandemic's effect on gender-based violence also has impact on incomes and on all aspects of life. And that you said it's a must know. So it's important to continue to integrate this programming or this element into your programming, but also that it seems like you were really thoughtful about how to make this message work for the constituents and members of these cooperatives, how to make it relevant to them, how to make it accessible, both as, an older group that might be uncomfortable, but also, within the scope of what they can do. So thank you. I also saw in the chat that Dr. Rebecca pointed out that, seeing very similar impacts, in Nigeria and all over. And so our next speaker will speak a bit about how this is, a global trend. We're unfortunately seeing this everywhere, but hopefully also seeing a change in adopting more of a response to GBV across lots of programming. And after this, we're going to have a discussion. So please continue to add comments in the chat box, and we'll make sure to come back to them. So Apta Garg is the Senior Policy Advocate for Gender with CARE USA, and she leads the advocacy efforts, particularly with the US government, to advance gender equality and the rights and position of women and girls globally. So the floor is yours. Thank you.
Thank you so much, Nellie, and thank you all for allowing me to come and speak with you. I don't have slides, but so I hope you're okay with me just kind of presenting a little bit about my experience as well as the global trends. And I noticed my colleague Anima also started to talk a little bit about this, but I think it's really important to emphasize that there's a wealth of experience from you all already. So my apologies if I'm kind of repeating a lot of the information that just sort of synthesizing what we understand about GBV. I think one of the things that we always try and contextualize when we talk about GBV and COVID is that many of the circumstances and the environments and contexts that we worked in we already underestimated the level and rates of GBV were underreported prior to the pandemic. It was deprioritized on a policy and societal level, and also, as many have already mentioned, normalized within communities. So we came into this pandemic with already an endemic of violence existing within communities and with households. Where laws and policies around GBV exist, they are either inadequate or they are poorly implemented. And furthermore, we also have kind of cultural understandings or societal understandings and social norms around these laws, wherein many times people believe that they are overly aggressive to the abuser rather than being protective and holding perpetrators of violence accountable. So this is some of the context that we've seen around GBV and specifically intimate partner violence and violence against children. COVID only took this existing epidemic of violence and sort of exacerbated or hopefully shone a light on why we need to address it early on. Also, in terms of what we understand about GBV, even prior to the pandemic, is that there are several factors that can help that can drive or make survivors of violence more vulnerable to experiences of violence. And that includes economic insecurity, use of alcohol, as well as witnessing violence as a youth. So one thing that we are very clear about is that young boys, even young girls who witness violence, in particular witness violence against their mother by their mother's partner, are more likely to then go on to either perpetrate violence in the case of young boys or be victims of violence in the case of young girls as adulthood. So there's also an intergenerational transmission of violence that we've came into the pandemic with. During the pandemic, there was a lot of understanding and research around violence. CARE did a rapid gender assessment under, which I can share the report with you. It's called the She Told Us report. And it was a survey wherein we asked over 6,200 women and 4,000 men in over 38 countries around GBV. And what we've learned from individuals in the communities is that women were almost twice as likely as men to report a loss of access to quality health services. And this really is particular for GBV, where these services can be life-saving for women who are vulnerable or in situations of violence. And women faced huge limitations in their freedom of movement due to limited public transportation and lockdowns. And with households at home together, survivors could not necessarily seek services without risking the notification of their partner. In Laos, we heard that 50% of the women that participated in the survey reported that they could not access health services because it was not safe to travel. And in addition, they don't trust the system. So how are these systems being set up prior to the pandemic in order to put survivors at the center of the provision of services? And nearly all of the countries included in the survey indicated a rise in GBV, increase in number of calls to hotline services. We saw in Argentina an increase of over 25% in hotline services for victims of violence, and a need for GBV health services, an increase in the need for GBV health services. One thing to note, though, is that many of these reports can be underestimated or underreported because internal tracking mechanisms are not robust. There's a reliance on phone surveys, which can put survivors or victims of violence at risk. Being in the household with one's abuser limits the amount of privacy one has to be able to feel comfortable and safe discussing or reporting these circumstances of violence. So because of lockdowns and there was an over-reliance on phone surveys, which can in turn sometimes compromise or put at risk levels of safety with victims of violence. And then in general, self-reporting around violence can tend to underestimate these numbers. I think when we talk about the normalization of violence, a lot of times individuals can recognize forms of physical sexual violence, but may not necessarily always recognize or report instances of psychological violence or economic violence. And we need to also be able to include that within the numbers. And due to limited mobility, accessing counseling services and other social support services can be cut off. In some instances, those were not necessarily always considered to be essential services the way that other services are. So when thinking about the movement or kind of initial policy around kind of lockdown measures and mitigation, was there a survivor focus or a gender lens within response systems? COVID also had a huge impact on economic security and mental health, as well as rates of alcohol. And as I mentioned, those are all drivers of violence and can increase vulnerability to violence. So we see like circumstances that are ripe for kind of compromising or putting survivors of violence in a position of higher risk. A UN Women Rapid Analysis reported that 45% of women reported that they or someone that they knew had experienced violence since the COVID-19 pandemic, and over 1 in 4 women felt that conflicts in their household had become more frequent. 7 out of 10 women felt that physical violence had just become more common in their household. And then we also saw that 6 out of 10 women believed that sexual harassment in public was more common, and 3 out of 10 women believed that violence against women in their community was far more common during the COVID-19 pandemic compared to before. We also need to look at this through an intersectional lens, because we saw that when disaggregated by employment status, women who were not employed tended to feel more unsafe than those women who were employed. And I think that goes back to when we think about economic security. Families who may have felt more economically insecure may have had more difficulties, mental stress, which could then lead to kind of that increased vulnerability. And in addition, women in rural areas felt more unsafe than those living in urban areas. So that all goes back to the access to services. In terms of looking forward, though, it's not, I think there's many ways in which we can think about how to move programming or how to create communities that address, prevent, respond to violence early on. So thinking about responses that amplify social services and support services. So cash benefits can help to support families during times of high economic insecurity and really address the potential harms and potential impacts of economic insecurity. And then also ensuring that a lot of the support is targeting support for women, not just necessarily general support. I think one of the things that has been a lack in the response around gender, around COVID responses is that, I mean, although women have always been and continue to be leaders throughout crises and in their communities, they're not necessarily thought of or included in the decision-making processes or kind of thought given the same amount of social services or cash services as other men in the community. So we need to kind of find ways to ensure that women and women leaders get the resources that they need in order to continue to be leaders and support services in their communities. And making sure that when we're talking about essential services, that GBV and other health services are considered and included as life-saving services and interventions during pandemics. In Canada, for instance, domestic violence shelters remained open, which was a huge boon for victims of violence to be able to find safety during the pandemic. And then in other areas, additional shelters and accommodations were opened specifically for victims of violence. Building the training of first responders and essential workers to understand violence and include survivor-centered approaches is incredibly important. So the work that my colleague Frederick talked about earlier is incredibly important to building understanding and awareness of violence, and then ensuring that victims of violence, even where there is limited social interactions, have access to support and resources. As I mentioned, putting women in leadership positions and at the center of responses, this can be a way to also be, before pandemics or crises begin, really investing in women leaders can help to build in resilience within communities from an early stage. And then also kind of thinking about resilience factors beyond pandemics. So investing early in programming and programming that engages men and boys around violence prevention and mitigation, and specifically gender transformative work. And when we talk about gender transformative work, that means not just necessarily talking about violence, but really thinking critically about how to address norms and normalization of violence, understanding how one's identity or what it means to be a man can contribute to violence is really, really important. We often reinforce, when I say we, communities often reinforce or normalize this idea that men are violent. There's a naturalization that men are violent, but no one is born violent. These are our norms that are taught to us, and specifically to young boys, this idea normalization of violence. And so when we break that cycle from an early stage, when we work early with young boys to denormalize or socialize care or an ethic of care, we can then build caring communities that are resilient in the long term. And I'll reference one program in specific in Rwanda. It was led by ROMREC, the Rwandan Resource for Association for Men's Resources, and Promundo had implemented a program, a gender transformative program, targeting men and their partners called Bandeberejo. And this program had been implemented a few years, but during the pandemic, there was a follow-up study to see how those couples that had participated in the intervention had fared during the pandemic versus those participants who had not necessarily participated in the intervention. And those couples that did participate in Bandeberejo during the COVID pandemic were less likely to report rates of conflict. They reported reduced alcohol intake, and women felt less stress than couples who had not participated in the program. So thinking about resilience factors early on can help to build a community where violence is not normalized and destigmatized. So I'll stop right there and let us move to questions. And I apologize if I went a little bit over.
No, that's fine. This, as Gunjan said at the beginning of the call, we always, the content is so interesting that we always don't have enough time. But thank you for also describing not only how it's sort of a perfect storm of contributing factors to making this, this crisis be heightened, but also how there's also, similarly, such a constellation of things that can be done before and in the moment at so many different levels that can reduce that impact. So there's a lot of entry points is one of my main takeaways, but I'm going to hand it over to Gunjan to direct some of these many comments in the chat box into a broader discussion and question and answer.
Yes, thank you, Nelly, and thank you, everyone, especially Apta and Frederick for those wonderful presentations, giving us a kind of a picture of what's been happening, what was happening with gender-based violence during the pandemic, but also different ways of addressing it, and a lot of which can kind of continue beyond the pandemic. So I saw a lot of great comments in the chat around, how some of these experiences have also resonated with people in terms of what they have seen in their own countries. Also, that there is a whole bunch of resources. So Apta will take the link for the report from you, Frederick, for the training materials, whatever is in the public, public domain. Sia has shared a resource from Girl Up. We will compile all of those and share them out as resources for us as we collectively and individually within our spaces try and address issues of gender-based violence. But for now, if you have any questions for either Frederick or Apta, then raise your hand or put it in the chat box, or just if you are on camera, wave your hand and I should be able to see you. But I want to first start to see if there are any specific questions on what you heard, and then we will move forward. And if there are no questions, okay, I see no hands, so I'm assuming that there are no questions. We're still digesting.
Dr. Saidu has a question. He's raising it.
Oh, Dr. Saidu, please.
Yes. Oh, thank you. I greet you all and all happy new year to all. From the gender differences and violence, if we can get some of the percentage in the developed country like Canada and so on, how do you think of addressing the one in Africa that is more severe than some of the country? That's my question.
Thank you, Dr. Saidu. And Frederick or Apta, would any of you like to come in?
I can start, and then maybe Frederick, if you want to chime in as well from your own personal experiences in data collection. I'll just mostly kind of emphasize what my colleague said, which is that data collection, I think, is incredibly important. And what we see is that there's huge gaps in what we're in data collection around GBV and violence against women. We have quantitative and qualitative methodologies to be able to accumulate and data around violence against women. But what we've seen is that our available methodologies weren't as adequate or weren't as able to address some of the needs during the COVID-19 pandemic. And so I think one long-term recommendation or possibility that we need to look at is really encouraging governments and communities to invest in data collection resources for us to understand the scope and breadth, as well as entry points for addressing and preventing violence against women. Phone survey and data collection has been always difficult due to privacy concerns, and mobile technology isn't necessarily as adequate in all areas. So really thinking innovatively about how we can do that data collection is a long-term investment for us to be able to get better, higher quality understandings and awareness of how we can address violence.
Great, thank you.
Yes,
Abdel.
okay.
I was wondering, Frederick, if you want to talk about either the data or generally, I think Dr. Saider was also talking both from the data perspective, but also generally in terms of addressing gender-based violence. You've had experience of doing both in the African context, so.
Thank you. Just a quick one. Let me mention that human beings are basically the same. And as Abdel said, correctly so, no one is born violent, and the violence is learned. It's a learned behavior, and the learning takes different ways depending on the environment. It starts from home, moves to the community, and generally the society. And therefore, even within the context of Africa, let me mention that it's really effective when you create a room, a safe space where people can talk about these things. People are willing to speak. And particularly, we do know that the main movers of GBV are basically men and boys, unfortunately so. And I'm ashamed to say that because I'm a man, but that's the truth. And the majority of the victims and survivors are women. And having said that, we need to know and understand the strategies of how to engage with men. And I like what Apta has just said. Having worked with Ramrek, actually I have engaged with Ramrek. I've been to Rwanda, even to build the capacity of Ramrek on how to engage men. And is that we do know that if we know how to engage with men, and the language of engaging with men, and making them realize that they are also suffering. No one ever benefits from GBV, not the survivor, not a perpetrator, because one becomes violent, whether it is physically or emotionally, the perpetrator equally is harmed by that act alone. And therefore, if we make men realize that they stand to benefit, because evidence has shown that when men realize the importance of any program, of any activity, they are very much willing to participate. But if they don't see the importance, they normally say, all right, the women and the children can attend. Even in school, simple things like even attending school activities. If they don't think they're going to benefit, but the moment they see they're going to benefit, they participate. And when they come, there are different approaches. So you can engage men, one, as clients, let them see that they have the need themselves and how they are going to benefit. Engage them because we need them as allies, because remember they hold resources in the world, more resources than women, because again of other social, cultural factors. And we need these resources to address these issues. So bring them on board, because even when they are there, it's going to benefit others, are they also benefiting. And also, if we can have them as the agents of change, let them take lead. And these type of strategies should, first of all, engage the individual. If you are dealing with men, after the men, can you also go a step further and engage with their peers? Because again, men are so much influenced by their peers. So even if a man has changed, but their peers are not changed, they'll fall back. Then you go to the family. These men go back home. They don't live in isolation, believe you me. So target the families, because sometimes men don't want to change because the families are pulling back. Even when they want to have gender equitable practices, they are pulled back by their children, they are pulled back by their wives, they are pulled back by their partners, they are pulled back by their relatives. Then you go to the community level so that you can change institutions and structures before now addressing the society where we have to have laws that are supportive. Sorry, I'm not conducting a training, but in a nutshell, even the language of engaging men. If you go attacking them, they resist. If you know the language that is inclusive, not attacking, they are going to embrace it. Anybody, once they're attacked, they resist. Another say they have been brought up to think that they are very important, even when they are not, unfortunately. Thank you.
Thank you so much, Fred. That was fantastic. And after, I realize, as always, we are really running behind on time. So we had initially planned to take this discussion to really talk about what have been some of the broad trends that we are seeing in each of the different countries, and if this increasing GBV has led to a change that we have noticed in response from governments and from other authorities. But I think what we're going to do is that we're going to move to the breakout groups, actually, and then we're going to address the questions there, but also in the breakout groups, keep this in mind. If you have seen a change in the response from authorities and others, funders on this, then also highlight that. I also want to say that this was a very, very important point around both what Dr. Saidu raised and Apta took up around data, right? Because it is not easy, and oftentimes, and this is true not just of data on gender-based violence, actually, it's true of so much of the work that we do, that getting the data from communities in Africa, in Asia, in Latin America, is not that easy. And how do we do this? And that's why we're hoping that the workshop on community-led monitoring and evaluation will provide us with tools and opportunities to actually do that, and show us how other communities have done this, so that we can then do this ourselves. I see two hands. Okay, I am going to very quickly take both Apta and Dr. Rebecca, but please keep your comments to 1 minute each, because we really have to go into the breakout groups after that. So Apta first, and then Dr. Rebecca.
Absolutely. I'll keep it short. Just that my colleague Marian had asked me, how is GBV financing a priority in Canada and worldwide? And I will say for Canada, I don't know that specific context that well. So I wanted to present it to the group, that maybe in the chat, if people are aware, have a better awareness of financing in Canada and the prioritization of GBV, to share with Marian.
Thank you so much, Apta. Dr. Rebecca.
Yes, I want to say that we have data, like my organization. I have in my 32 years of service, I have 2,100,000+ data, because everyone we give support. We have their details, their children, and what happened, and even the list of people killed in Nigeria. I have a lot. Why? Because we have good relationship with the people. Unfortunately, some of my data was destroyed by Boko Haram, but we still have plenty. And when we partner with UNHCR, UN, and all this, we got very, very excellent data. So we have it in Nigeria and some organization too.
Thank you, Dr. Rebecca. So we will work with you to see what can we do with that? How can we use that data for advocacy and other purposes? And what that data can tell us, the stories, and how do we take it out? And again, some of it we'll cover in the next workshop that we do. But for now, thank you for sharing that information. And again, thank you very much, Apta and Frederick, for those really, really insightful comments. And Nasima is not here, but it was wonderful to get the picture from Bangladesh. And now, Sarah, if the breakout rooms are ready, we will do breakout rooms for 20 minutes, and then we'll come back. Please appoint one person in your breakout room to report, not a summary, just one thing that stayed with them, one thing that struck them as in something new that they learned, some idea, something that was triggered from the discussion, to report back. And then we'll go into the details of the Mel Workshop for next week. Okay, Sarah, are the breakout groups ready?
They're ready. I'll open them now.
Perfect. Are we doing 2? Oh, 3. Okay.
as everyone comes back into the main room, I want to ask Gertrude if you would share one thing from our group that stuck with you when the time comes. Welcome
Sorry,
back.
everyone. We brought you back early, Nelly. Over to you.
Yeah, I think the time has come, so we can, since we
Yeah.
only have 7 minutes left.
Yes, we are always quick. So I think people are still, I think there's maybe one more group that will still be coming. Oh no, we maybe are all here. So we obviously forgot to ask someone to take a key takeaway, but maybe the other groups were better at remembering. So I was group 1, so I will first go to group 2. Is there someone from our group who can share a key
Yes, Colleen is going to report what she took away from group 2.
Yeah, I have lots of bolds on my note, but in the interest of time, I'll say there were 2 things that we must share. I think one was we talked about a person is only as safe as they are connected, and that connection is not just in the moment of crisis, but all of the pieces that come afterwards, especially, you know, that chain of legal support, the financial support, the vulnerabilities. And then we also talked about the lifelong trauma of gender-based violence and really understanding that it walks with someone always. Whenever you see it, it carries with you, and that the psychosocial first aid is also a really big element that everyone, because we all share a hand in it, everyone needs to, that's an area where we can all focus.
Group 3, Benjamin's group.
I'll go ahead and report for group 3, if that's okay. What a lot of us have in common, or most of us, is the power of individuals within communities. What kind of women's network or community network is in place during these times, and communications with the organizations to keep this open forum going. So the power of individuals and communication.
Gertrude like to share from our group?
I don't think people could hear you, Nellie.
Oh, I was asking if Chris or Gertrude wanted to share from our group. But if they don't, I will say one thing that came through was very much how there's a lot of moments where you can introduce messaging around GBV. It can come from the high level, but it can also come in around discussions of economic activity and economic development, child rights, et cetera. So there's a lot of different entry points, as we had said earlier.
Thank you. Thank you, everyone. I wish we had more time for this discussion, but we are in the last few minutes of the call. So we wanted to very quickly share with you more about the Mel Workshop. John, if we can get the slide deck up, and also a couple of upcoming events that are happening with the movement. So the Mel Workshop, it's going to be a 90 minutes workshop. And what we're going to do is that community-led monitoring and evaluation is really, really a vast area, as many of you may know. And so covering everything, or trying to even really cover community-led, the whole aspect of monitoring and evaluation in 90 minutes is going to be very tricky. So what we're going to do in the February 16th workshop is that we're going to focus on community-led monitoring. So the International Treatment Preparedness Coalition has developed a methodology, a toolkit, lots of easy resources for different community-based organizations and communities all over the world to do community-led monitoring. So we're going to have them come and share and workshop with us, starting from how do you do it? Starting from the principles, but really getting into then, so if we want to do community-led monitoring, what do we do? Like, how do we go about it, right? Like, what's that process look like for us? And then how do we use that data? Dr. Rebecca, for instance, mentioned that there's a lot of data that she has from Nigeria, right? So how do we effectively use the data that we have for advocacy and for furthering the goals that we want to further? So that process is what we hope to go through in the workshop. And they are going to bring in a couple of, you'll hear from actual community-based organizations in some countries of how they have done this process, right? So we hope that that will be a starting point. We are collating some resources that we will share with you. Now, after that, if people want, we can do a second workshop at a later point, looking at, what community-led evaluation would entail. Next month's workshop is specifically really going to look at community-led monitoring. We will make pre-registration mandatory for it because it's a workshop, so we can only have so many people in it. And we want to make sure that everybody actually has the experience of, in the breakout groups, we are actually going to be going through this thing of, in our context, if it's COVID-19 or whether it's gender-based violence, whatever it is, how do we begin to do this? How do we begin to identify the indicators and, then start collecting for it? So that's going to happen. We will send out a form shortly for everybody to register. It'll be a first come, first serve basis. So apologies for that. But so please, as soon as you get the link, if you are interested in it, please do fill up so that we know and we can plan accordingly. And if you think you're not going to be able to make it, then please let us know so that somebody else can get that seat and be there. If there is anything specifically on community-led, Mel, that you would like from the workshop, please let us know. Nellie and I are reachable. You should have our email IDs, otherwise we'll put them in the chat box. But just let us know. The form will also actually have that. But if there's something specifically you would like from that particular workshop or a later workshop that you feel needs to be covered on this topic, tell us, and we will, make sure that that's answered. But we need to know to be able to make sure that it works for you. Okay, next slide, please. Upcoming events. I want to highlight 3 things. We'll have our first global call, monthly call next week at 9 a.m. And we're really going to look at capacity strengthening next week. So please log in. And if you have experiences to share, if you have tools, if there are resources that you have created on different aspects of capacity strengthening and different aspects of the work that we do, let us know in advance. We can share that out. It would be a phenomenal opportunity to share it with other colleagues from all over the world so that, that work can carry forward. We have officially been accepted, our side events, for both the CSOC-D and the CSW, so Commission on the Status of Women. The CSOC-D event is actually on February 10th at 8:30 a.m. And there we are looking at financing community-led action for inclusive, resilient post-COVID-19 recovery. We have a very interesting lineup of speakers there. So we're going to have Jenny Hodgkin from the Global Fund for Community Foundations. We are going to hear from the government in Kenya. We are going to hear from local governance networks and representatives. We really have a very healthy lineup of speakers for that. It should be an interesting session. And then we, of course, have the special workshop on February 16th. So that's kind of the roundup for the events. Because this is our first call of the year, I want to do 2 things. I know we're 2 minutes over, but I want to request everybody, if you are able to turn on your camera, I would love to do a photograph for everyone. So that's one. And the second thing is, for those of you who can stay a couple of minutes, if you have any specific expectations that you would have from the Mel Workshop, especially the community-led monitoring workshop for next month, then please let us know. All right, I see the cameras gradually coming on. So everybody who is not able to switch on their camera, I will give you 10 more seconds in case you are able to. Otherwise, we will do the picture. Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, everyone. I've taken a screenshot. I hope somebody else has as well. Wonderful. Thank you, everyone. As always, thank you for staying over also with us. And yeah, if anyone has any last thoughts, you can unmute and say them or just say bye.
Bye, everybody.
Oh,
Thank you.
bye.
Okay, thank you
Happy
all.
to be here. And thank you very
Bye.
much.
Very much.
Bye,
Bye,
thank
everyone.
you.
Bye-bye.
Thank you, Frederick. You were amazing.
Yeah,
Thank you.
Thank you.
You're most welcome. Thank you.
Bye.
Bye
Bye.
bye.
Bye, everyone.
Bye.
Bye-bye.
Bye.
Madam Amadi.
Bye.
Kai, yadi ngatum sraka sura tege room tena mai ama gadi pali slow.
To
ama gari mampa.
wa kitikamar ko bo mwampani kada kitikamar. Kamnya ndakwa shifsu dama na harapani. Sakalaga kata namta sakalaga kata zamta.
Sorry.
You're speaking in tongues. You're speaking in tongues. It's all right. Bye.
Okay, bye, everyone. Bye, Sarah. We can end the call, and I don't think anybody had any feedback on the Mel thing.
Bye, everyone.
Bye.
Bye. Thank you
Bye.
all.